lot of people that have POTS and have EDS can also have positive ANA. It's interesting because one of the diagnostic criteria for hypermobile, oh my God, hypermobile EDS is the absence of an autoimmune connective tissue disease. So that gets kind of tricky. Like if you were tested for like an ANA, there should be a reason that you were tested. So just because you have symptoms of like EDS, like doesn't mean you should only be tested for like an ANA. So having the negative ANA is beneficial to be able to have that diagnosis of the EDS. Now, is it common to see like a negative ANA in borderline Sjogren's antibodies? It can be, yeah.
An ANA, we've talked about this in a lot of our videos and also in a lot of the lives. ANA, which stands for anti-nuclear antibodies, are a kind of umbrella of antibodies. Sjogren's antibodies, like SSA and SSB antibodies, are a type of ANA. So if you only have kind of low borderline SSA, SSB antibodies, which are the Sjogren's antibodies, it might not present as a positive ANA because though it's the ANA is the totality of all the ANAs together, and if the Sjogren's antibodies are not high enough, it might not flag the ANA as a whole. And so it's kind of sometimes you can get these sort of root patterns where an individual antibody will come back positive and then an ANA might come back negative. Sometimes you get a positive ANA and nothing comes back at all, and that can sometimes be because the individual antibodies aren't actually elevated, and it's another part of the ANA that's not as common that we're not testing that's actually elevated. And whether or not Sjogren's is part of POTS or HEADS is like kind of complicated because autoimmune diseases can co-occur with EDS and POTS, but because the diagnoses are challenging based off of symptoms, you want to try to separate them, even though they can co-occur. Are they common to co-occur? I would say before we used to say no. I'd say now probably more than we thought because we're making better distinctions now. Mm-hmm. So